So Giovanni, tell me about this clinical case. This is a 10 years mucoderm.
Yeah, that is the 10 years follow-up case. It's a very interesting case because we start with a hopeless tooth from a periodontal point of view with no loss, no bone loss, no bone at all. And the very, very interesting case is that what we know from many times is that by means of orthodontic extrusion, even if there is small amount of bone remaining around the apex of the tooth, we can really gain so much amount of bone in height that it's possible to place an implant. But what we have to realize is that as much as we extrude the root, the diameter of the root becomes smaller and smaller. And this means that we can bring bone and soft tissue in corner direction. So that is very good in height. But there is really no increase in the volume, in the thickness. And as much as we extrude the root, the volume of the tissue in the buccal lingual dimension are reduced. So the extrusion of the tooth is a very, very good way to avoid vertical bone augmentation, but nothing to do with the soft tissue management. The soft tissue management has to be done in 100% of the cases in which we need to gain bone for placing the implant. And this is, according to me, one of the most important indication to the use of the substitute material, and mucoderm in particular, because in this case, since soft tissue height has been gained thanks to the orthodontic extrusion, what we need is the increase in the soft tissue thickness that is completely missing both at the buccal aspect and at the base of the papilla. So it's a buccal lingual increase in the soft tissue thickness, which is the main indication for the use of mucoderm. And most probably this is something that we at least knew also more than 10 years ago, and this is the typical case in which there is a very big concavity, so there is the complete loss of the emergence profile of the implant-supported crown that was placed on this implant because no soft tissue augmentation was done at the time of the implant placement. So what we did is we removed the old crown, we left the soft tissue heels all around the implant head in order to gain some amount of improvement of the soft tissue all around, but as you can see, the thickness of the tissue was almost nothing, and this papilla was so weak, so there is also high risk of papilla shrinkage with time. And during the surgical procedure, you look at the concavity we have here in the emergence profile, where at the level of the adjacent teeth there is still the bundle bone of the adjacent teeth. And in this specific case, we used the wet material in order to increase the thickness, and we just reduced the thickness of this material in the interproximal area in order to facilitate the suturing technique. So this is a modification that most probably I wouldn't do today anymore, because in 10 years time I improved my suturing technique, so there is no need to reduce the thickness. But this is another advantage of this material, that like you can make the desepitalization of the connective tissue graft, you can use your blade and your microsurgical scissor to reduce the thickness of the material where less thick increasing the thickness is necessary. So that is another advantage of the material. And after the healing, you see what an incredible change of the volume from the beginning, but you also can see the completely safe procedures. There is no inflammation, there is no sign of sufferance of the soft tissue in the coverage of this material. And from the beginning, there is a complete change of the emergence profile of the implant-supported crown. Also, the height of keratinized tissue is increased, and this is not strictly related to the use of the material, but it's related to the improving the soft tissue margin position and the realignment of the mucogingival junction that makes biology works, and this make the increase in the keratinized tissue together with the increase in the supracrestal soft tissue thickness. Also, the base of this papilla was increased from, let's just say, immediately after the surgery, few months after the surgery. And then the final restoration was delivered about 9 months later with very, very nice emergence profile, and this patient was undergoing to a control every single, I don't remember, 6 months oral hygiene, because this is a patient coming from abroad, and so he makes some oral hygiene in his town, and every two times a year it comes to Bologna for having the control visit. And we have also some nice picture of the intermediate healing, that it was about 5 years of healing that was very, very stable. This is the 2 years, then we have the 5 years of healing, which was incredibly stable. And now, as I told you, I recalled the patient a few days ago. We have the 10 years follow-up, in which if you can just see a difference between the situation at 2 years, at 5 years, is some further increase in the thickness without changing the volume. Look at this. This is an outcome of the connective tissue graft that you see. It's very scarred in comparison to the healing of the mucoderm. And this is exactly what I was telling you before, that the tendency of today is to avoid to use connective tissue graft when it's absolutely not necessary because of this scar appearance and excessive of soft tissue overgrowth. And this is the stability after 10 years in the emergence profile. Look how this crown is shortened now in 10 years time with respect to the beginning, and despite the crown is shortened, look how much this papilla is more coronal with respect to the beginning. So this is really the goal of the soft tissue management, which means emergence profile and papilla height. Obviously, this is the picture of the emergence profile of the implant-supported crown that is identical to that of the natural tooth, but the natural tooth has the root. And in the case, the soft tissue increase in the thickness compensate the lack of the suprabony component of the root, and also from a radiographical point of view, it's really a case of great success.
Fantastic. Thank you. Grazie, Giovanni.